Hi, I'm Teresa Price, and I'm one of the providers here at St. Michael's Clinic. So I'm going to take you through what it looks like once the patient gets beyond intake and back to the back. Here's triage, and this is Jenny. She's getting ready to check a patient in, and this is where the patients get weighed and get their vitals done. And then we have 4 exam rooms. 3 of them are used as normal exam rooms, and then the third one is actually a procedure room. So we'll show you that in a minute. This is your typical exam room, and it should feel like you're at the doctor's office because it's just a normal room. We've got the exam table, we've got the otoscope and ophthalmoscope, we've got everything that you would need. Providers who would be coming and volunteering would really just need to bring their own stethoscope, and that's about it. And we do PAPs, so of course each of these tables can be transformed into with stirrups. We've got lights in every room where we can do minor procedures as well. And then our procedure room over here is where we do lumps and bumps. Taking off lipomas, opening up sebaceous cysts, doing punch biopsies, removal of and biopsy of lesions that might look cancerous. We can send them off to the lab. We've got a nice little surgical light and a table that goes up and down. We've got all sorts of equipment that you would need for sutures, for abscesses, for any kind of procedures. We've got that all available. Also in this room is a FibroScan, which not many offices around here in Anniston have. This FibroScan checks the liver for steatosis and fibrosis. That we can tell if a patient has fatty liver or if they have scarring in their liver that's leading towards cirrhosis. We've got wound care in here as well. And down here we also have orthopedic supplies. We do casting here in conjunction with an orthopedic surgeon who gives us a consult and says, yeah, that patient just needs a basic cast, we'll do that. Of course, if the patient needs surgery, we refer them on. We also have on-site CLIA-waived lab testing. We've got the autoclave for all of our instruments that we're using. The lab tests that we can do, just spot testing right here in the clinic, would be your normal things like mono and strep, flu, COVID, a urine dip, a urine pregnancy. We can do urine drug screening. We can check an A1C for those who are diabetic. We can check a hemoglobin. We can check a white blood cell count. And then over here we have all of our injectables. So when they're in the clinic, if they're needing a steroid shot, a Rocephin shot, and any kind of injectable medicines we keep over here. So that's your basic walkthrough of what we're doing. We like to call it primary care plus, or comprehensive primary care. This is the primary care that you would get for a patient who is needing primary care, but also if they need a little bit extra and they can't afford to go to see a specialist. So we've got patients on Depo-Haldol because they can't afford to go see the psychiatrist. We've got patients on medicines like Humira because they can't afford to go see the dermatologist or the rheumatologist. And we, of course, are working in consultation with these specialists, and usually the patient will have at least one visit with a specialist, and then we will resume their care, so that they just need to have a few less specialty payments because they can't afford it at all. And we're able to order imaging, we're able to order labs, and the imaging is written off by the hospital graciously for us. The labs we write grants for in order to pay. So our patients, really, this is cost-free. Patients are getting all of this for $0.